All right, thank you everyone for joining today. I hope this is not a long meeting today. Seems like the world's starting to get back into some semblance of order. I hope everybody is taking it gingerly. As a reminder, please mute your speakers, but don't hesitate if you do have a question to unmute. Certainly do not place your phone on hold because we'll be able to hear your music. So today I'd like to just take a moment and see if any of the DHHS staff are on this morning or NPHL.
This is Allison. I'm on from DHHS.
Awesome. Thank you, Allison. Anyone else? Well, Allison, it's you and I this morning, then.
All right.
Okay. Well, we want to welcome all of you again on the chat box, which you will find somewhere on the ribbon. You can, what can I find the chat box? Here we go. You can go ahead and place your facility name and all of you that are participating in this morning's meeting. I would greatly appreciate that. Obviously, the main topic still is the coronavirus. I was hoping that we could speak a little bit about the statewide testing that you're starting to hear about. There are a number of them that have been contracted in the state to do testing. Obviously, the biggest one you've heard about is Test Nebraska. It is a group out of Utah. Allison, do you know anything more about that particular testing that you could share with us?
Can you, what's the question? Can you repeat that?
Oh, sure. Just the question about the statewide testing with Test Nebraska. Are you familiar with that at all? I know Dr. Donahue is handling it more, as is some of the other DHHS. I'm not as familiar with it. Just wondered if you had any comments on it.
I'm not super familiar with the specifics of Test Nebraska. I know that's been launched and the website is up for people to kind of do a self-assessment to see if testing is appropriate. And I believe that they do, I think once you're done with the assessment, they do give a list of like testing facilities. And oh gosh, I'm trying to think of the gentleman's name. Doug, he's the one that's kind of organizing, like if someone wants to be a testing site as part of kind of that initiative. Let me see if I can find.
I think his name is Doug Carlson. You're right.
Yes, thank you. Yes, yes. So he's the one that's kind of helping get testing sites on board and part of that initiative. We've been here at the state, we've been kind of trying to work with Inductive Health, who's our informatics contractor, because one concern we have is that all this extra testing is going, we want to make sure that it doesn't overwhelm our system. And so we're kind of working with them to make sure that we're able to process labs in a, in a timely manner, but at the same time, not slow things down, because then that can impact the time that it takes to get to the lab, and then of course follow up as well. So we kind of want to reduce that lag time as much as possible.
Yes, thank you. That's about what I know of it too. I do know that there are probably 3 sites from the last I've heard that's in Nebraska. I know it's a lot of work for those laboratories bringing those systems in, but I'm thankful, I guess, that we do have ample testing in the state for those who do need it. So I also want to share just a little bit about our local health departments. They do talk every week, probably several times a week, to a number of different parties. So hopefully you've gotten to know your local health department well through this whole process. I think that they are very busy, but hopefully they can give you the guidance that you need if there's any questions and such. Local health departments are now working, a number of them, with the National Guard and our nursing homes. From everything that has been planned now in the state of Nebraska, there are, believe it or not, now 6 sites. I think last week we only talked about 4 sites. There are now 6 National Guard units that are in the field. They actually have contracted with a number of different labs, even beside Nebraska testing. And that would include LabCorp, Quest, and then of course, the Nebraska Public Health Laboratory. A number of our specimens are coming through there. It can be confusing at times. I appreciate all of the laboratories that have helped us with the courier part of the National Guard. Some of you, unfortunately, have had specimens drop off without even notice, and that's because they've changed their locations or times, and we've not been able to keep up. So if that happens to you, don't hesitate. Just give me a call or our client services number a call, and we'll help you through what needs to be done with those packages. National Guard is scheduled to continue for probably the next 2 to 3 weeks. I know that their priorities this year this week is to go ahead and do all the sites with the meat processing plants, as we know that those are the hot spots in Nebraska. I think we are beginning to realize also that some of the hot spots are our homeless areas and our nursing homes. Douglas County truly has been hit, I think, with quite a few numbers heightened in the homeless areas. So it only makes sense. People close-knit together, not great protection. It's important that we keep a good eye on those sites. Now, I also know that National Guard and local health are working in our nursing homes as well. Those usually are smaller quantities. I believe who's actually collecting them are the National Guard are coming in, simply because it's overwhelming for even the nursing homes to do their own collecting. I think that they don't feel as comfortable doing the nasal pharyngeal swab, say, as the National Guards are now. With that, I'll stop and ask, of the things we've touched on so far, does our National Guard, or excuse me, our client or clinical laboratories have any questions about those particular items? All right. Hearing no questions, I thought I would just go on and maybe review very quickly some of the clinical lab status as far as couriers, packaging, and shipping. Couriers, again, I think we have got them working to the nub. They have done the best they could. There are times where it sounds like they're running a few minutes late. So do bear with them. Although if you know that a courier is supposed to be there and you haven't seen them yet, certainly give client services a call. Couriers, has there been any questions about your couriers? No question about couriers. Has everybody been able to get your specimens out, especially the COVID specimens, on a timely basis? Do you feel that things are working as smoothly as they should be? I know it's Monday morning. We have a talkative group here.
Erin, this is Christy Nickel from Bryan. One of the situations that we had over the weekend was we did have a sample that we were wanting to send to NPHL, and we had to hold it because we don't have a courier coming on Sundays, and we can't call for a courier. As you know, we're still sending the bulk of ours out to LabCorp just because we were getting good turnaround time and didn't want to waste all of our resources locally for that if we could. Are we at a point where you think it would be beneficial for us to send them back to you at NPHL and potentially get another courier run on Sundays?
You know, that I thank you for asking, Christy. Yes, it's something that we are always open to take specimens. I mean, yes, we do have our criteria. The reason we have our criteria of you know, in-house, or if it's out of house, that they need to have close contact, or they have to be older than 65, have a comorbidity, or showing symptoms. If you do have those kind of patients, we still encourage you to send them to NPHL. And if you don't have a courier on Sunday mornings with you in Lincoln, that would be something we could arrange. And granted, it might be a little more expensive if we have to get a what they call an exclusive courier, and that would be.
Hey, Karen.
Yeah, Teresa.
Karen, this is Teresa.
Yeah.
So I didn't catch who was on from Bryan. Is it Christina?
Yeah, it's Christina Nickel.
Okay. Okay, perfect. Yeah, we can get you a courier on Sundays. That's not a problem at all. And then, are you talking about? I know you mentioned LabCorp. Are you talking about sending more than in lieu of sending to LabCorp, sending to us? Is that what you're asking?
Yeah, we were wondering, just because really one of the reasons that we were using LabCorp, in addition to trying to keep their resources for Nebraska local, was the New Alert is a good system if you are sending a handful of specimens, but when you're sending like 100, it's a lot of work. And so that's why we had also transitioned ours to LabCorp, and we were getting good turnaround time, so we were leaving them there. But I just wondered, like for healthcare workers, since we're not getting a huge amount of those, would that be something that might be better to keep in the state and send to NPHL instead of LabCorp at this point?
Yeah, it would. And if we need to set up a Sunday courier, I think as far, we'll take advantage of the regional courier network, the regional pathology courier network, and we already have couriers coming out on Sundays. So it's not even expensive to add. So
it's not a special, and even if it were after your courier routine, it's
not expensive.
Yeah, we can still get it. And I do recommend that if people have a special situation, I had one from outstate where they're concerned about a patient who, interestingly enough, came in just for some cardiac reasons, didn't have any symptoms of COVID, been there for 5 days, and then also all of a sudden turned unwell and had started showing symptoms. Well, at this point, they did not have him pinpointed as a COVID patient. So now they're very concerned about their healthcare workers. So that is a great case where you should give us a call and we can see what we can do. So thank you, Teresa, for hopping in on there. Any other questions on couriers?
I did have a meeting.
One other comment I'd like to say about couriers is the fact that certainly now the specimens you can simply give to your courier via a biohazard bag, making sure that the requisition is in the outer pouch. It is also appropriate to send, like, for instance, these large shipments, National Guard, nursing homes, and trying to promote them to be shipping by category B and utilizing very specific category B marked containers, which in the future is something that I think unfortunately all of us might have to look at, but for now, with the pandemic situation in place, I'm not going to worry about it at this point. So it is appropriate to use a category B box, just so long as you have a cooler type box, and especially if you have to ship dry ice, that would be by far the best way to go. Because obviously my current boxes that I have out there with the circular containers on the inside, those are only for culture plates, supposed to be ambient, therefore they really don't handle a cold pack well at all, or for that matter, you're not ever supposed to put dry ice in those. So anyways, that's what I can share with couriers, and that really does get into a little bit about packaging and shipping.
Yeah, and I'll just say, you know, if anybody doesn't like an answer they're getting from client services, or just needs more clarification on a courier and wants us to be extremely, you know, inventive and innovative on helping you guys get your specimens in, then I'll put my email and cell phone number on the chat, and it is in all of my emails. So
yeah, and I could even send that out, Teresa, in some of my communications that I sent to all my laboratories and even some of the clinics. So certainly. I thought I'd stop for a second. I see that Jan from Family Medical Center has a question that they ordered the collection kits last week. It says she did check with the local health department and they did submit the order, but they've not received yet. Currently, we have a daycare with COVID. Oh, yes, definitely important. So I will ask Teresa and Anna Carpenter to look into that.
Yeah, Karen, if you look below, I responded. They were sent
good. All right.
on Friday. Yeah.
I didn't see that. So you sent Friday, you should be getting it today. Jan should be getting it. Okay. Thank you for taking care of that. I can't keep with the chats here. So, all right. Good to know that. Okay. Last but not least, I kind of wanted to bring up the topic about safety, and where safety is concerned. I think it's always important to re-review the things that we've been doing in lab. So are we keeping safe? Are we using the proper PPE in lab? Has anybody run out of PPE and are doing things maybe a way that you necessarily did not want to process? Are you doing any aerosolizing procedures on the open bench top? And in reality, there needs to be PPE if you don't have a biosafety cabinet, which I know a lot of you don't. So there are other ways to mitigate the risk, and that could be just a desktop a shield, some sort of face shield too across your face is an excellent way to keep aerosols out. And last but not least, the masks. Now, granted, the what do they call it? The surgery mask is not near as safe as, say, the N95. If you are fitted for one, and NIOSH says you don't necessarily have to be fitted within the year, but you are allowed to wear an N95 if you have them. A lot of labs don't have N95s. So any comments, questions about safety, any changes that you have all gone through? Christy Nickel, your question about what is everyone seeing for turnaround time at NPHL. Now, our staff tells me that we've been trying our best to get those out within that 24-hour basis, but I do know that National Guard specimens have been really pressing us. There have been some days where there were 400 or 500 specimens. And they have been told that National Guard specimens actually take second place to the patient. So they will literally put their patients on first and then work with all the National Guards. So if it's delayed even 24 hours, more than 24 hours, it shouldn't be more than 48. Does anybody have any other experience though? And don't hesitate to say. Okay.
It seems to be a couple of days. This is Gerald from Syracuse. On the weekends, is there a different testing regimen, or do they have fewer shifts, or is the weekends the same as during the week?
It is pretty much the same, Daryl, on the weekends. We're down maybe 1 or 2 people on the weekends, so there's 2 people left to do the actual testing. It's a long day for them. But as far as I know, they usually can get it in. They usually get in 2 runs at least. So might even put a 3rd on for the evening and read out the next morning. Have you had longer turnarounds during the weekends?
We have, but it's hard to know whether it's a courier situation because we have an account regional, but we don't have anybody that comes regularly, so they have to send out a courier. So a lot of it's probably more courier related than testing. They seem to be doing okay. I mean, obviously, providers want it, 2 hours ago, but if they're sitting in the inpatient or a nursing home waiting to go back, we are running into a lot of those where they're just not. Good Samaritan will not take them back. It's their corporate policy. So if you have a Good Samaritan, they won't take them back unless they're tested. So that's been a real headache for us.
Oh, that's certainly something we could bring up to DHHS. Allison, I don't know if you're still on, but that might be worth jotting down for any of the meetings that you might be on. And ask about priorities of some of these people.
Karen, we're seeing a lot of that here in Lincoln too.
Yeah.
A lot of different facilities, long-term care or assisted living, where they're saying, no, you have to have 2 negatives, or even if they haven't even been under suspicion as a COVID patient, if they've been in our hospital, they're wanting a negative before they'll take them back, sometimes too.
And I've also heard the question that sometimes they don't turn negative. And how do you handle those kind? I have to admit that's beyond my scope. I wish I had Dr. Tierney here to walk through the process of return to work or return to, normal life. What some of those criteria are.
Hey, this is Karen. This is Robin. Actually, I have requested them to talk about that on the noon call today about appropriate testing for people who have been direct contact to a positive case. So if you guys want to recommend your facilities and physicians, and you guys can listen to that noon call, they will be going over that once again.
Yeah, and I usually sit in on those, Gerald, again from Syracuse. So they have a great algorithm they have for the nursing homes and stuff. It's just, honestly, I don't think they care. The corporate doesn't care. They're like, well, that's risk, and we're just going to make sure they're. And the sad thing is, it's only a presumed safety because obviously the PCR is a point in time. I have a question. Is anybody looking at serology? I mean, I'm a little bit perplexed as a laboratorian that we're mandating such, not necessarily people with clinical symptoms, but this mass screening with a molecular method. I mean, that just seems inconsistent with other, basically any other infectious disease that we have. We usually screen first with serology. I know the serology is not good, but doesn't it behoove us to wait to allow the serology to get better? Because we're going to test all this with the test Nebraska and everything one day, and it's good for one day. You know what I mean?
Yeah,
and then
exactly.
this fall, test again, which is really,
right.
I think, just my opinion, I think is foolish, this, personally. I'm just going to say it.
Totally understandable. I think that there's a lot of questions out there. So actually, that would be information we could share our thoughts on that with this new meeting. I have not shared that with you guys, but if you don't have that, I will send out an email right after this with the for that noon meeting. Dr. Tierney, Dr. Safranik are those primarily who moderate that meeting. And I think that that's a good venue to bring these opinions up as a laboratorian. I totally understand. So,
hey, Robin, sorry, Karen, this is Bryan Buss.
Oh, yes.
Yeah, I did want to address the comment, about serology versus, a molecular test. And one of the benefits of doing a large volume of molecular testing is for us to be able to react on that from a public health standpoint to say, is a person currently symptomatic and do they currently have a positive test? And then if that's the case, it does allow us to move in and attempt to do case investigations and contact tracing. So that's the biggest benefit. From a standpoint of saying, is a person totally cleared of the infection? We all know that's not the case, and that's the message we as public health have been trying to push from the very get-go, is that a not detected on a molecular test does not exonerate a person from having been infectious. So from a public health standpoint, even if a person has a negative test, if they still have symptoms and an epilink or a known exposure, we're still going to ask them to isolate, and we're still going to, continue to quarantine the people around them unless we end up getting, some evidence that that person has, some other reason for their symptoms. So in a perfect world, it'd be nice to have both a serology and a molecular test and be able to line those up side by side. And, we're not quite there on the serology side, but, there really is some value for this level of testing to be able to do public health action, but it's not this simple dichotomous, does a person have the infection or not? And there is, I think, this false security, I think, that the public feels, by calling a molecular test at one point in time a negative test. But, all of us on the phone, that doesn't necessarily rule out infection. So, I just wanted to address that. And, there really is a lot of pressure to ramp up testing, from a lot of stakeholders. So, we're all kind of, kind of in the middle of that, but I really appreciate the efforts of everybody, boots on the ground, and with the labs and doing the collections on folks. And we are able to find people that need to be isolated that we may not otherwise have that, stick, if you will, to push the necessity that they isolate. So, it does really help from our public health actions. So,
Dr. Buss,
certainly, I've looked at it both ways, so thank you.
Yeah, no, thank you for sharing that. By far, that's obviously the most important thing, because as we know, the tracing is the real name of the game. So I appreciate you sharing. If I may, I'd like to add one more thing to that. And I had a physician call this weekend who apparently works with a number of immigrant and lower economic patients. So their concern was that groups like Test Nebraska is a great idea, but worries that they are hitting the wrong population. If they're sending out these surveys, they're hitting the people who have the economic worth to have cell phones and is illiterate to read. So are we really hitting the sites such as our homeless, and as you obviously know, the packing plants we are, but he was concerned that there are other populations we are not hitting with that particular type of test.
And this is Gerald again, not to, and maybe I need to clarify my comments. I'm not concerned with what the hospitals are doing. I guess I'll just put it point blank. Do we know, is the Nebraska, the Test Nebraska, is that testing people that are symptomatic, or are we just testing the walking well? I guess that's my question. And if it's the symptomatic, I think that's probably acceptable. But if it's the walking well, then I think the cost is too great when we have a shortage of reagents. That's my concern.
Yeah, this is Bryan again. I certainly appreciate that. Test Nebraska has actually been a parallel work stream from the work stream that Karen and I and NPHL and Nebraska Medicine and CHI and other our other commercial labs have been in. So that is a separate initiative. What I have been involved in is seeing some visibility on the algorithm that goes into it to determine if a person is going to be recommended for testing. Its focus and the objective is to try to find people in the community that might be infectious that otherwise wouldn't present for healthcare. And we all kind of know that there's this tip of the iceberg, and the tip is the people that present for care and the positive tests that we get. And we know that there's some level of iceberg kind of below the line where we're detecting people. So the idea is to try to get some means in a large volume to get out and find people that are potentially infectious in the community that might not otherwise know that. So that's the reasoning. There is an algorithm. It's my understanding there is an algorithm that runs to determine if those people are symptomatic, and it denies what do I want to say, an invitation to get tested for people that don't have symptoms. So that's the goal with it. But I've actually been had limited visibility in all the processes. So that's there's other people that can answer questions on it better than me. One thing I would say is that I know that team that's been rolling this out on the governor's team, they have been thinking about trying to find ways to reach the populations that maybe wouldn't have a data plan or a smartphone in their hands. So they're thinking about things like that too, and working with the communities to try to get at populations where that'll be an issue. But again, I don't think anybody on this call has really been in that workflow. So I really can't give you a whole lot more than that. And even at that, it's somewhat, I don't want to be seen as the official the official stance on it.
Thank you, Bryan. Yeah, and I know that our National Guard really are the ones who do the testing, the priority. They go where the hotspots go, sometimes even if it's not on the schedule. So they're very flexible, and I know that they can hit these areas. So Thank you for
Yeah,
that.
Karen, I would say that there was some desire from leadership to have a little more of a set schedule with the National Guard, and I think there may be a little less flexibility going forward. So I think, you know, our partners need to be aware that there may not be quite the flexibility that we had, you know, up to this point. So I think, you know, it will depend on the various situations and what's going on in those communities. But, you know, we're really dealing with hotspots in the packing plant communities, and even the team that's supposed to be the most mobile is kind of tasked out around packing plants right now. So not to say that it couldn't happen, but there will be, you know, some decisions that'll have to go into it by, you know, by some team members that are helping coordinate scheduling now. Aaron Grope and some of the folks he's working with.
Yeah. And that's understandable. I do know over the weekend that in Douglas County that there was some testing that did happen. So that necessarily wasn't scheduled. So I'm glad that there is the flexibility, though, in smaller numbers to be able to do such things. So.
And I would add on that one, Karen, that was actually a team that forfeited their rest day and went in, and I heard on the call from Audie Poor that they collected, you know, in the mid 300s, you know, on what was supposed to be their rest day. So, you know, really great effort by the Guard, and, you know, we just can't say enough with what the Guard's doing to help, you know, our response. And again, you know, everybody that's boots on the ground with the labs and the couriers, and, you know, you guys are all making a difference. And you know, the governor gave a shout out this morning on a call for the efforts of, you know, everybody in the labs and everybody out there doing these collections. And, you know, the work is not going unrecognized. So it's, you know, I just wanted everybody to know that at the very high levels, you know, everybody's work is being recognized, and we are making a difference. So thanks to everybody.
Thank you, Bryan. The mic is open for any other questions. All right.
Karen, I was wondering, oh.
Go ahead.
Do you have other topics?
No, I do not. We're done for the day.
I was curious if we could go through the batch list process on New Alert to just refresh everybody on the purpose of that list. So I didn't know if you minded going to New Alert.
No, not at all. Let me see if I can't switch over. Just give me a moment. If you want to kind of describe the process while I'm trying to bring it up.
Yeah, so whenever you are ordering lab tests, each individual lab test gets a requisition, which prints out when you submit your order. Then as you submit it, there's another screen that pops up and says, hey, do you want to print a batch list? And that screen is valuable if you're sending just the one patient, then you can go ahead and send your batch list that way. And the way you guys have been doing it is fine as well. I'm just thinking of being more paper conscious. And so it seems like on every patient that gets ordered, we get the rec and the batch list. But there's actually a way when you're finished ordering to go up to the tab that's called batch list, which Karen's got she has a black mouse hand there. So hopefully everybody can see the tab up there that says batch list. So you would click on that. And it looks like it's working there.
Yeah, just slow. Really slow.
As those of you who know Tony Goldenstein, she would say the Cheerio is spinning.
I do like that. Let me try it one more time here.
Are you on Chrome?
Yeah, I am actually.
Oh.
Well, I got two of them up now, so let me.
Maybe they're doing work.
Yeah.
On there. So nonetheless, you would go to that batch list feature. Maybe it would be, if you go to the Nebraska Public Health webpage, there's a quick guide in there. Let's just do that. Yep, and then go to where you have New Alert Go Live. No, oh, yeah, that works.
Is it this one here? User manual?
Nope, go back to home. And it's in the hot topics, New Alert Go Live. And it's the 2-page, I can't read that. Yep,
Yeah.
Does that say batch or?
Yeah, 2-page, click here for 2-page overview.
Yep, perfect.
Yeah, okay, there we go.
So I don't know if you can zoom in on that a little bit, but this is a really great guide on how to just generally use New Alert. And so if you scroll down to the second page, yep, that zoom was perfect where you had it. Yep, great. Scroll down to the second page there.
There's the batch.
And so, yep, so on the right-hand column here, it says printing a batch list. So you go to, and it might actually carry over from the bottom of the left there. Let's see. Nope, it doesn't. So, okay, so great. So you just go to that batch list via the navigation header, and then it says select your appropriate date range. So I wish we had a photo there, but we don't. But it's a very simple form, and it just says put in your date range. So you would just put in the day you're ordering, and then you select your ordering site and your account code. So the site is probably going to be, you know, like let's just use maybe Great Plains. So Great Plains would be the site, and then maybe Great Plains has 2 or 3 accounts listed underneath them. You would select all of those. Most of you have one account and one, I guess One World would be probably a better example of having multiple accounts because they have multiple locations. So again, it would be very simple, and then a list pops up, and it's a batch list there. So scroll down a little bit. And it will have, for all the accounts, so this particular one had 3 accounts. There were 1 patient under each account. And it's important for us to get the batch list. And it's nice if you have a collated view of all the patients you just ordered. So we can ensure that we got all of the samples. It's really a transplant list. And then what we do is that barcode that prints on each one of those lists is a way for us to easily access your recs that you sent in anytime via our document scanning software. So our document scanning software recognizes that barcode and then marries it up with information that's keyed in on your account. And then we can easily access all of your information. So like I said, it's okay to get 1 per patient, but in an effort maybe to save trees or just kind of streamline so we know exactly everything you sent, it would be good if you do the batch list after you're done entering and ready to send. Does anybody have questions about that?
Teresa, in the packaging and shipping world, that is known as our list of contents. And in reality, that's required. So if you're not sending a requisition, you should be printing this batch list to be included with your specimens. So thank you for going over that.
You're welcome. And if anybody has any questions, again, I put my email and cell phone in the chat, and you know, leave me a voicemail if you want, and I'll get back to you if I don't answer. It looks like there's another question about, is there a way to get results from New Alert that were collected at the National Guard sites? We aren't getting results on patients from our local health departments because they're so busy with other things. The answer is yes. So I had sent out an email last week that said, here are all the sites. Let me know the users that need access to those sites. So we can't just give a carte blanche access, unfortunately, just because of HIPAA rules. But If you're in Douglas County and you want to have access to the National Guard Douglas County site, we can grant you that. Then you can go and look at your patient results. Also, I was able to get a really nice Excel download with all the patient demographics, all the account codes, and I threw it into a table and a pivot table in order to siphon out different results and patient demographics that you guys might be missing. And so if you need your download of that, just let me know, and then let me know the site you need it from, because I know there were a lot of people saying, hey, we're 500 people backlogged, and I know it can be cumbersome to look at every single patient at this point. So it may take me 24 or 48 hours, but it'll still be easier than Mary Jo, we'll get you on the, I can send you that email if you'll just send me your email address.
Okay, thanks.
Yep. So same thing for Angie Valdez. Yes, we just need to know what facility you need access to. And in that email, I listed all of the facilities since March that have a result for a COVID test. So it's a really easy way to see, okay, this is the facility name and these are the account names under it. And you'll notice when we first started with this, a lot of things got entered under the DHHS EPI account. And so I subbed out the different locations under that account, and it's all in that email. So I can send that email to Karen, or Karen, you probably have it if you want to resend it out.
I might. Certainly.
Okay.
So after this, I'll resend that, and then also I might put that invitation in for that noon meeting if people want to catch that. I also know those noon meetings have been recorded. I should find the site in which people can kind of backtrack. There's been a lot of great information put there, and I'd like to share that too. So I'll get that together and try to get it out here in the next couple minutes, so that if they want to listen over their lunch hour, they're welcome to.
Looks like a lot of people must have my emails going to spam or something. No, I'm just kidding.
Yeah.
So
Karen,
we'll get it out again. Yeah.
Okay.
Daryl, go ahead.
I think it's on the Nebraska Hospital Association.
It
those
is.
recordings.
Right. Thank you for that reminder, but that's exactly where.
Yeah, and then the other thing I'll say is, we had done some troubleshooting on patient demographics and results that weren't crossing. And I know a lot of you utilize NEDS. I am not familiar with NEDS, but we found out that there was a problem between the information transmitting from NEDS or from New Alert into NEDS.
Yeah.
That's all been fixed. But again, that's why I'm saying we've got this spreadsheet. So instead of it being this really grueling process, we can definitely just send out the spreadsheet with your account codes only.
Yeah, so the whole point is, if you're struggling with the New Alert and it's not working for you, please call our client services. Did I hear another question?
Nope, this is Allison. I was just going to add to what Teresa was saying. So there were labs coming from New Alert that didn't have race, ethnicity, and patient address on it, which are super important for us for follow-up and to do data analysis. So NPHL resent those labs, and that's all been fixed. And I know that information, I think, is required in New Alert, so hopefully all labs that are ordered through New Alert contain that information, because we here at the state, we really want to get that information so we can kind of characterize the outbreaks and make sure that those labs get to the right health department, so follow-up can happen, in as timely manner as possible.
There is another question on the chat that I'd like to direct maybe to Dr. Buss if he's still on. One of our laboratorians has asked about viral loads.
Are you looking for, is it
and James, I don't know if you're on, that you could elaborate more.
Talk to them over there. Okay.
Yeah, let me see if I can find that email real
Yeah.
quick, because it was there was a couple of questions.
Is Dr. Buzz still on? And certainly this could be something that I know I haven't had a chance, but I talked to my MPHL people about viral loads. You were wanting some sort of a mapping or graph that showed viral load of a patient before symptoms and then how long afterwards. Of what I don't think it's the same as viral loading, but I know that a patient can be contagious for 3 to 4 days before showing symptoms, and even 3 to 5 days after symptoms is what I know, but I don't think that's the same as viral load.
Karen, this is Bryan. You know, I don't know, you know, what the exact question is there, but I would probably defer to Peter, Emily on that. You know, I had seen some earlier work, you know, regarding, you know, cycle times and whatnot, and, you know, and cutoffs, but I wouldn't claim to be an expert right now, you know, so I defer that question to Peter, Emily, or somebody that's, you know, more a subject matter expert there.
Yes.
Yeah, and I sent the email. I first sent it to Dr. Safranek on the 28th, and I hadn't heard anything, and so I forwarded to Karen and thought maybe she could send it to either somebody else that maybe would be able to better answer it. But it was basically 2 questions. Was I've been trying to find information, either words or a graph, that could help explain a patient's viral load versus virus contraction, like symptom onset, post-symptom kind of time frame. And if you have some information or know where I might be able to find it, because I've tried the CDC website, I've tried Googling it, I've tried DHHS, Nebraska, a few different places, and I just couldn't find anything. And then we were also trying to find the progress of the viral load during the incubation period, both asymptomatic and symptomatic.
And I know that I did try to send that on, but I suspect that our groups is just so busy right now that they haven't been able to look into that yet too. So James, keep reminding me. We'll continue to look at work on that process.
I don't want to keep pestering you.
That's all right. That's what it takes sometimes. I understand.
Well, the squeaky wheel gets the grease, and
yeah.
You know, that's just the way it goes. But no, I mean, you know, I know Tom Safranek and others, you know, are just, you know, suffering from massive information overload. And you know, if there's something that's kind of falling through the cracks, it, you know, just keep bringing it back up if it's something that really needs to be addressed. So, but Karen, I would defer on that, because I do not. There's people on this phone call that are far more experts than I am.
Well,
you know,
I can send this to whoever I need to send it to get it answered. I mean, I just wasn't for sure who would best be able to do that.
You know, to be honest with you, James, it's quite possible that some of that, this is also new, that they might not have that information out there, and not in good quantities, testing like, or evaluation like we would like to see. So, but we'll continue.
I would say that, Karen, I would say that CDC has changed their guidance, you know, on release from isolation, and expanded that a little bit more from where we were. So, you know, there is some concern that the infectious period after, you know, after symptoms resolve might be a little longer than what we had first thought. And when I say we, that's just the collective we, you know, and working on CDC guidance.
Sure.
You know, so I know that CDC guidance is based on some of that information. I just haven't been able to get down in the weeds with the literature, just, you know, not enough hours in the day.
Yeah, for sure. All right, any last questions? Our time is growing to a close, so I thought I would ask one more time. And if you want, you're welcome always to email or call. Bryan, thank you. Allison, thank you. Teresa as well. I appreciate all of you.
Hey, can I ask a real quick question of Teresa? Teresa, Thanks so much for walking through that. And one of the, the questions we were getting with the National Guard testing is, how can a medical provider, find, their patients? So, and I apologize if you started on it and I missed it, but what you were offering then, just so I'm clear, is that you're offering that our partners in the labs, if they're in Douglas County and they say they know that there was testing in Douglas County yesterday, you're giving them access then to that particular testing pool of the potential people that would be in New Alert that were tested through that event, and then allowing them to look them up by patient name to find them. Is that what you're offering?
It looks like Tricia jumped off.
Yeah, we might have lost her. So Bryan.
Well, she's showing muted. Can you answer that, Karen? I just wanted to confirm because, I think that's really important that a medical provider could look their people up to know what that test result is, so that they're not having to wait on the local health departments, to try and turn that information. It'll be really helpful.
Yeah, what the question was earlier, and the reason that was brought up is because a number of patients entered into New Alert didn't have, say, address and phone number, so contact information. And I do think that Teresa has been helpful in bringing up like mass results in a spreadsheet format, so that if people had 500 specimens they were behind on trying to enter this, that it could be done in a different way, in a more efficient way. And so that's what I think she was offering. But yeah, physicians should be able to look up their results, and it can easily be done.
Well, but that's a result when they're the ordering provider, and when it's under the National Guard, right. It's not going to be under a person's normal primary care provider. So right. I'm just putting it out there that if Teresa's able to make that available, so that, if the doc has somebody come into the office or call them and say, hey, I got tested through the National Guard the other day, and they want to validate the result, it would be good if they could go into New Alert and search for that patient by name and date of birth. Sure. One thing I would caution, though, is that we've got some parallel testing going on with the National Guard, and not all National Guard testing is going to MPHL now. So there is some National Guard that's going to LabCorp, and there's another workflow that's going to Quest. So, only a portion of what the National Guard is doing is going into New Alert now. So just so that everybody's aware of that.
Right, and I will ask Teresa to clarify for you, or even give you a call. May I ask a question, Bryan? Is even the other laboratories using the red cap first and then takes it into their systems? So are you doing that for
each of the other laboratories that we're working with, basically the Guard is doing MPHL, LabCorp, and Quest, and what's going to MPHL through regional pathology, some of that's going to Nebraska Medicine.
Sure.
We are using red cap for the intake at all the drive-through sites for the Guard outside of Test, Nebraska. The Guard sites that are going to these three labs, we are working with LabCorp and Quest to build an interface, but at this point it's dropped to paper for the requisition, and LabCorp and Quest are actually having to do data entry when those specimens are received.
Yeah.
So it is kind of hurting our turnaround time. What New Alert has for an electronic order requisition and a direct interface and a real-time connection with RedCap is really the model, and we're trying to build that out. But kudos to MPHL and Nick Steffend and others on your team down there to build the interface with our RedCap system, because it's really helping with the turnaround time and more efficient processes in the lab. And the receiving down there, so that way, you guys can be doing lab work and not sorting through mountains of paper. And we're trying to improve that with LabCorp and Quest, but we're not there yet.
Well, I know it's a slick system, so I'm very glad it worked out. We'll get back to Teresa and try to get that question answered.
Okay. Thanks, everybody. Thanks, Karen.
All right, seeing that it's 11 o'clock up, I appreciate everybody being on the call today. I'm still going to schedule for next week again. If you have any questions you need before then, don't hesitate to call. Thanks all.